Okay, let's see here. Let me get this set up. Oh, that's not good. Let's do this. Okay. All right, that looks better. All right, let me see if I have anybody here. No. Okay. So, yesterday I got caught up doing some stuff at home, remodeling the living room. So, hopefully this thing all ends and we have you guys over for dinner. You guys will be able to see it. Anyway, so I didn't get to it yesterday. So I will lecture some today, and we'll just keep working through this. So um, last time we discussed the respiratory system. We talked about these different areas. We talked about the two different zones, the respiratory zone where all this oxygen and carbon dioxide actually exchange, and then we also talked about this conducting, the ability to get the air to the lungs, okay? And so we started to explore this area up in here, and we talked about the 5 different functions of the nose, which is just providing a way for air to get to the lungs, to moisten and warm the air. We talked about the ability for these mucous membranes to filter the air. We have this area for smell with the olfactory foramen from the ethmoid bone, and then also it's a resonating chamber. Because if we hold our nose, we sound different, right? So it helps with the sound of our voice as well. And we also talked about how not only do we have this mucus and cilia here, right, in this area, but we also have it in this area here. These are lined with mucus and cilia so that air, when it gets down there, any dust or debris or anything gets caught on the mucus, and the cilia take and push that up to the throat so it can be swallowed or spit out. They call that the mucociliary ladder. Okay. Now we talked about the difficulty is if you decide to be a smoker, the smoke kills the cilia. So the mucus is still there, traps the garbage. However, you're unable to get it, doesn't carry itself up to be swallowed or spit out. So therefore, you have a cough and you're constantly coughing because any type of irritation to this airway will trigger a cough. And so that's why they call it a smoker's cough. All right, that cilia in your nose, and it's cold, they get sluggish and it doesn't move the snot around, and therefore you end up um, you end up having a runny nose. Okay. We talked about these nasal concha or the turbinates, right? They're in there for a reason, to swirl the air, to not allow the air just to quickly go shooting down into the lungs, because we want to warm it, we want to humidify it, and we want to filter it. And if it just is able to shoot in there undisturbed, then we're going to have an issue. And because we might not be able to warm it enough before it gets in the lung, we may not be able to get the humidity up on it enough. We may not be able to filter it near as well. We don't want dust or garbage in those thin areas, those lung, um, those alveoli. And we'll learn that. So we got a few people here today. Good. Okay. So we got that. All right. We talked about that. We talked about this nasal cavity. We have the hard palate here, the soft palate here. The soft palate has the uvula. When you look in the back of your throat, and what you see hanging down, that is your uvula, not your tonsils. Okay. So your uvula, when you swallow, this will move up and close that off. All right. We talked about how the sinuses. Here's a normal sinus, not impacted, full of garbage and stuff. Okay, they help to lighten the skull, they resonate, they have mucus in there. Okay, and with a chronic sinus infection, we end up getting a sinus that is filled with garbage. Okay. We talked about the pharynx, right? We have the naso, the oro, and the laryngopharynx. Okay, and so these provide passageways, right? So this up here is air only. Okay, this here is air, food, and water. Okay, air, food, and water down here in the laryngeo, air, food, and water here in the oro, but only air in the naso. Okay? The nasopharynx is air only. Soft palate usually arise. So when you cough or you laugh, and you are able to cough or laugh quicker than your uvula and your soft palate is to close that off, milk comes out your nose, pop comes out your nose. You sneeze a strand of spaghetti. You see the thing on like America's Funniest Videos where you see the little kid sneeze and there's spaghetti out his mouth and spaghetti out his nose. Ugh, right? That's this. That's that. It was faster than the uvula and the soft palate. Okay? So, air only, okay? The laryngeo and the oro is food, liquid, and air, right? The food will be directed posteriorly to the esophagus. Air will go anteriorly, okay? So back here is the esophagus. Anterior is the airway. So air's forward, the food goes back, okay? So now, when we talk about tonsils, um, the when we talk about, there's a bunch of different type of tonsils, okay, and so the name of them will tell you, right? So the pharyngeal tonsils or the adenoids are located in the nasopharynx, okay, and so we know that that is up there in the back of the nose, above the throat, okay, and so that's what you have your adenoids. So when you have your tonsils and adenoids taken out, basically you're taking out your palatine, which is located in the oropharynx, and they're taking out your pharyngeal tonsils, your adenoids. Okay. Okay. Your lingual tonsils are located at the base of the tongue. Okay. All tonsils are lymph nodes and work with the immune system. Okay. So tonsils aren't just there to be taken out. Okay. They're not a mistake. Where some people have them that need to have them taken out and some people don't. Right. They are part of the lymph system. They are part of the immune system. All right. So taking them out, you are. I mean, it's you don't want to have them out unless you have to. Okay. So your adenoids are your pharyngeal, your oropharynx, your palatine is your oro, and your lingual is at the base of the tongue. Okay. So now your larynx has three different functions. Okay. So your larynx. Okay. So when we talk about that, we're talking about here. Okay. Larynx. Okay. It provides a patent airway. All right. So your larynx and into your trachea, like if you take and you reach up underneath your jaw and you reach around your throat and you kind of go down the sides, more the anterior portion, the midline of your throat, you can feel how you can feel something rigid in there. That is your trachea, and the top part, the higher you go, you're getting up there into the larynx, right? So this is an airway that does not close down. Okay, it is open. Okay, it acts as a switching mechanism between the respiratory and the digestive. Okay, so we have this area here of a patent airway, but then also it can switch, and if you decide you're going to swallow a bunch of pizza, the act of swallowing will switch it and shoot that pizza down your esophagus, not down your trachea. Okay, and then also our voice, the way we're able to, these vibrating chords here, that is in this larynx region as well. Okay, so three functions. We have an open airway. It directs food back to the esophagus and air to the trachea. And then also it's where we are able to produce vocal sounds. Okay? So the Adam's apple, okay, which is the thyroid cartilage, is up in here. Okay, it's seen externally as the Adam's apple, right? So we have this thyroid cartilage. Okay, the thyroid is down here, kind of inferior to it, and we have our thyroid cartilage. So it is more prominent on men, seems to be, but you can feel that bump right in the midline. And also, when you swallow, you can feel it move. And if you look here, you can see these muscles that are attached to that. Okay? Okay. So here's our larynx. Okay? We have our, so here's the anterior. Here is our thyroid cartilage. Here's our cricocartilage, okay? And up and through here, we have our hyoid bone up in here, which if we remember we talked about, it's a kind of a free floating bone, but it anchors as it's kind of anchored for muscles to help with the swallowing. Okay. So this is the larynx. So the anterior view, you see the thyroid cartilage, the cricocartilage, the hyoid bone is up in here. You have muscles that are attached to these things. And then we can see the part of this trachea where we see these rings, and we'll go through that. And that's really what you're feeling. That's what you're feeling. Okay, hold on. All right, so the epiglottis, ninth cartilage. The epiglottis, when air is flowing into the larynx, the free edge projects upwards. Okay, so this is kind of like a flap. So when we're just breathing and we're not in the act of swallowing, this thing is just kind of like vertical. That free edge is flapped up, allowing the air to go down into the trachea. Okay? Now, when we swallow, the larynx is pulled upward. All right? So when you swallow, you can feel things raise up towards your chin, right? So when that happens, the epiglottis tips back and closes over top. It closes over top of the. It tips back and closes over top of the inlet for the trachea, right? So if we're going to swallow food or water, that epiglottis flips back, closes the entrance to the airway, and directs the food and the water posterior down to the esophagus. Okay? So that larynx gets pulled up, that moves the epiglottis to close off the airway so we don't have food and water go into the lungs. We don't want that. Okay? All right. Now, what happens if so just like when we were up here, when we were talking about this, right? Where the soft palate the uvula, they close off so that food and water won't go. Well, sometimes we cough or we laugh or something and we sneeze, and that we're able to move that food and water quicker than this is able to close, and stuff comes out our nose, right? Well, what happens when something happens to where we beat the epiglottis, or the epiglottis is late to the party, and so what happens? Well, that's when we get a cough, right? So when you say, "Oh, sorry, that went down the wrong pipe," right? Oh, that drink went down the wrong pipe, and you cough and right, and sometimes it takes a while to get over it. All right, that's this. That's because of this, right? So what we're going to do is we're going to do this. So it's initiated if anything other than air enters the larynx. All right? So if anything, I'm hearing okay. So so what I'm seeing here is so if anything other than air gets into that space, you're going to get a cough. Okay? Pressure from air moves upward out of the larynx. Okay? So what a cough is that your lungs or your diaphragm, whatever, it causes pressure increase down low, and it's going to shoot air out of your larynx so that you can take and remove whatever is getting in there. Okay? All right, so now reflex does not work when people are unconscious. All right, so when people are unconscious and they've passed out or they've had a seizure, you see people, they roll the person to the side so that they don't choke on their own vomit. All right, you don't try to give somebody who's unconscious a drink because chances are they're not going to swallow, and so that airway is open and you're just going to pour water into their lungs. Okay, or if you get people who are in an alcoholic coma, right? They pass out on the floor and they die because they vomit and they don't, and they're unconscious, and so they can't cough it up, and so they just, but they're still trying to breathe, and so they're sucking that down into their lungs, and so vomit in lungs is not a good combination, right? And people die from that. All right, so anything that gets into the larynx other than air is going to cause you to expel it. All right, but it doesn't work if you're passed out. Right, so you don't give your unconscious whatever brother a drink. Okay. All right. So the trachea is this area here, right? So this trachea is, we're talking about here, right? So we've gone through this, talked about the turbinates, we talked about why we have those, we talked about the hard palate, the soft palate, the uvular, the nasopharynx, the oropharynx, the laryngopharynx. We talked about the larynx has the vocal cords, and it has this epiglottis, and it has directs food backwards and air into the airway and on. But now we've gotten into this main trachea here. Okay, this passageway for air to go to the lungs. Okay, and so where are we at? We're here. Okay, they're your windpipe. So this is that mucociliary ladder or escalator or whatever, right? It's lined with the mucus. It's lined with the cilia. Okay? It propels the mucus, which contains dust, particles, debris, to the throat so that it can be expelled or swallowed. Okay? So we have that in here. We want that in here. We want to still filter warm the air, right? And so when we get like when you're baling hay and you got all like garbage in your nose, and then you know that your nose didn't pick up all of that. So then when you take and you're spitting and hacking something out, and there's just stuff in there, but that's a protective mechanism, right? We don't want dirty air into our lungs. Okay. So smoking diminishes the ciliary activity, right? Coughing is the only method of preventing mucus from accumulating in the lungs, right? So if we have the mucus here and we're collecting garbage, but yet we're unable to get it to carry up, then if we don't cough it out, then it's just going to keep filling up the lungs. And we can't have that because you can't breathe through mucus, okay? So coughing is the only method of preventing mucus accumulation. Smokers should never be given medications that inhibit the cough reflex. All right? So if you are a smoker or you know somebody who is a smoker, giving them cough medicine or having them take something that diminishes the cough is going to be extremely bad for them because they don't have this. They have the mucus, they just don't have the ability to get it out. And so now if you're suppressing their cough, then we're going to start to see this. Mucus accumulation in the lungs. Okay? We can't have that. Okay? And as we get into the respiratory portion zone, we talked about the alveoli, right? The alveoli, whatever, where the air exchange, that is a very thin, one cell thick wall. So for easy, whatever. Now you add mucus and cover that with slime. Are you kidding me? You're never going to get any air through there. All right. So you can't do that. You can't give medications that inhibit the cough reflex, right? If a smoker You don't have to be sick if they're like, man, I'm tired of coughing. Give me something to suppress this cough. No, you can't do that. Sorry, buddy. You killed your cilia. You're just going to have to cough. You're just going to have the smoker's cough. Okay? So when we look at this, and we look at a healthy lung, and we look at a smoker's lung, uh, this looks pink and healthy. This looks sick and weird, right? The deposits of tar, this weird color. You got. Um, so regardless, okay, I don't think it's hard for if I pulled out a steak to grill, I think we would want it looking pink and red and like that, and rather than coming out black and yellow like that. Okay. Okay. So when we talk about the trachea, oopsie, when we talk about the trachea, right? When we talk about this thing, when we look at this, all right? So this is a good thing right here. So if we look at this, see how we have a C-shaped ring here, okay? And they are hard and they are rigid. Now, again, grab your throat, go below your Adam's apple, and go down into your throat, down to your neck. And as you go down through there, if you feel, you can probably feel bumpity, 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 bump, right? So you're basically running your fingers along these cartilage here, okay? So this trachea is reinforced internally by 16 to 20 of those C-shaped rings, all right? So when we look here, there are 16 to 20 of these C-shaped rings, right? They're C-shaped, right? They're not complete. They're open here in the back. All right? We want to remember that. The outer portion of the C causes the trachea to stay open, right? So unless someone crushes your throat, so people who have been strangled, they have crushed these C-shaped rings in the trachea. So you can tell. So that's forensics, right? If someone has been killed and they see that some of these have been fractured or whatever or crushed, they will know that they died by strangulation. They closed down on the windpipe and right. Okay. All right. So we get that. So the outer portion of that C is to keep that airway open. The inner portion, the open portion of the C, allows the trachea to be flexible and gives the esophagus a place to expand into it upon swallowing, right? So if we had a bunch of solid rings, our neck would probably be less flexible, right? If you take something that's a ring and you try to bend it or move it or whatever else, we would lose some flexibility. A C-shaped ring with an open end is a little bit more flexible, but yet it still keeps that airway open. Now, the other part is that esophagus is right behind that trachea. Let me get up here, right? So the esophagus is sitting right in here. And so, I mean, you've all done it where we haven't chewed our food well enough and you had this big old bite of pizza and you swallow and you're like, oh my gosh, and you can feel it rake all the way down your throat and just going all the way down and stretching your esophagus all the way down until it plops into your stomach. You're like, oh, right? I mean, you've all done it. You're all laughing and you're all smiling because it's happened, okay? If we had a completely closed, an O-shaped ring, right, where that would make it difficult, we'd have to chew our food really, really well so that that esophagus would have less place to expand if that wasn't open back in here, like this. Well, hold on, I probably have a diagram I need to, well, anyway, right? So, we have our trachea that we're looking superiorly down, okay? Here's your front of your body, here's the back of your body. Here is that C-shaped ring, and that C-shaped ring keeps that opening open for air. And then back in here we have our esophagus. So if we eat a huge piece of pizza or we don't chew our Doritos well and it feels like razor blades going down, right? But it can expand into this area and allow for a bigger bite of food, okay? So the esophagus protrudes into the back of the trachea when you're swallowing. The mucous membrane portion of the trachea permits the esophageal expansion when allowed. Okay, so it's designed that way. Intelligent design, man. All right? So, but we see this, okay? Cartilage act to keep the respiratory passages open during breathing. There's some glands in there secrete mucus for the mucociliary ladder. All right, so this is all. The trachea is flexible, but it's patent, right? It's flexible, but it doesn't close off. No matter which way we bend our head and neck, it doesn't close off. Okay. Now, the Heimlich maneuver. What in the world? Let me get rid of this thing. The Heimlich maneuver. What the world? Anyway, the Heimlich maneuver. How do I get rid of this? Oh, uh, oh, wait, I thought I had it. There we go. The Heimlich maneuver is the same principle as a cough. All right, so let's go back over a cough. Anything that gets into the airway triggers a response, and a pressure from down low, we build pressure and we push upwards to eject whatever is in the larynx that has messed with our airway, right? We're going to cough, right? Now, the Heimlich is basically we're creating a cough. Something has lodged in the trachea or the larynx or whatever else and has gotten caught in there, and a cough is unable to get it out. And so what we do is you get underneath them, they're on the diaphragm, down below in the abdomen, and you you squeeze forcefully up, and causing the air pressure to go up, trying to expel whatever is lodged in that small area. Okay, so a Heimlich is basically you're creating a cough. Okay, so this kind of goes over how you make a fist. You lean the person towards forward slightly and stand behind them. You put your arms around the person, grasp your fist with the other hand near the top of their stomach, just below the center of their rib cage, right? So just below the xiphoid process, kind of tuck it up in there, right? And then you're going to make quick, hard, inward, and upward, right? And so when you say quick and hard, you want to give it to them, all right? So, anywho, there you go. So let me do a couple more of these. So a tracheotomy. All right. So here's a tracheotomy. Tracheostomy, right? An ostomy is a hole that's cut into something, right? So people have had a colostomy, right? A colostomy. That's colon ostomy. So people that have like the bags that are on the outside of their body, it's called a colostomy. It's a hole and it collects waste, right? So an ostomy is a hole, right? So a tracheostomy is used in cases of abnormalities, cancers, obstructions, injuries to an area, whatever else. But you're going to cut a hole in the throat, provide a pipe to get in there so that they can breathe. So if something gets lodged here and we can't get it out, we could still get breathing motion if we can create a hole here. So, hold on. So, you're going to make that hole right there. Take a pencil, jab it in there, get a straw, stick it in there, and in the cases of emergencies. Anyway, laugh it up, but that's what it is, right? So that's what they've done here. They've gone below the thyroid cartilage, in between the cricocartilage. You feel it. They've punctured it. They've cut a hole. They get a tube. They stick it in there. All right. Now, when people have these, they tend to not be able to talk because the air doesn't travel up through the larynx, which doesn't vibrate the vocal cords. So what they do is, a lot of times you'll see people that have these, to talk, they will take their thumb and close over the hole and do the talk, and they'll try to talk, and then they'll shoot air through those vocal cords and be able to make some noise. But otherwise, they're unable to talk because the air escapes in and out of here, not in and out of here. I know I am fascinating you all right now. You're dumbfounded, and you're just so excited to hear my voice, and I get it. Okay. Um, the bronchial tree. All right, so when we talk about the bronchial tree, here we're kind of here, right? Here's our trachea. Now we get into this area here, the bronchial tree. So if we want to put it into a bigger perspective here, we're talking about here. We're talking about here, trachea, and then we're talking about down into here. Okay. So the bronchial tree, the trachea divides into the right and left primary bronchi at the level of the sternal angle. Okay, where the manubrium and the body of the sternum meet. All right, so hold on. The manubrium, which is the top part, and the body, which is the middle part, where those two meet, that is about where our lungs divide into the right and left primary bronchi. Okay. So inhaled objects. So when Billy decides he's going to swallow a button or a penny or a popcorn seed or a marble, and they think it went into his lungs, most of the time you you will find an inhaled object in the right primary bronchus because it's bigger, it's shorter, and it's at more of a vertical angle, right? So anatomically speaking, this is the right, this is the left. It is bigger, it is wider, it is more of an angle, okay? So if something's going to be flying down here like a marble or a popcorn seed or whatever else, when you take an x-ray, they're like, oh, yep, there it is. There's your earring or whatever stuck in there. There's a, so that's what they're going to see. Okay? Looks like they did a little bit of a surgery there. Anyway, okay. All right, so the bronchial tree. We have a main right and a main left. The right one is more vertical, it's bigger. Most things will fall down in there if you swallow them or you inhale them or whatever else like that. Okay? So you have your right and your left primary bronchi. Sorry. Okay. I'm going to do a couple slides here and then we'll be done. The left lung, when it comes to lungs, left lung is smaller, consisting of two lobes, okay, and contains a cardiac notch. So we can imagine what sits in there. If you remember when we looked at that video of the pig lungs and they held those things up and they had the heart nestled in there, it is kind of more up into that left side, okay? And so there we have the left lung is smaller and it has that cardiac notch. The right lung has three lobes. Okay. Bronchopulmonary segments served by own artery, vein, individual segments. Bronchus left lung has 8 segments. Okay. Okay. I don't know if I really get into that too much. Okay. But you're going to need to know that the left lung has 2 lobes. The right lung has 3. So when you look at this, all right, so here they're doing the segments, different segments of the lung with different arteries and stuff that feed them, okay? But you can see the trachea, the bronchi, main bronchi come down into the lungs there, okay? Respiratory therapists and surgeons use this information about the bronchopulmonary segments so they can treat the patient as needed, even to the point of removing the disease segment and leaving the good tissue. All right, so the lungs weigh approximately 2.5 pounds. All right, so with the lungs, they're divided into segments. Okay, the left lung has 8, while the right one has 10. Okay, and so that would be important if, let's say, I don't know, we had a punctured lung, and it is in this such and such segment of the right lung, or we have cancer in this segment, or these two segments, or whatever else. So they could direct and be more specific as far as location goes of something that's going on. The lung weighs approximately 2.5 pounds. All right. Um, they feel really weird. They're real spongy and it's almost like a memory foam. We'll watch the video again and you can see that. But all right. So we kind of flew through some stuff today. That's okay. We'll probably have a quiz sometime early next week, meaning like Tuesday or Wednesday. I'll have a Zoom session to answer questions, but that's a pretty good amount of stuff there. Get your corrections in. Make sure all your stuff is turned in. and I probably need to grade it because Chris needs to have his. But anyway, blah blah blah. So anyway, like I said, I apologize for yesterday. I was painting and all this stuff, and I realized I was like, oh man, I forgot. So um, anyway, I will. Talk to you guys on Monday. If you have any questions, give me a call or give me don't call me. I don't want to talk to you. Just leave me an email or whatever. Again, try to use my other email, not my school email, because I never check the school email. Thomas, Chris, who else does it? Naomi, who else does it? Anyway, so all right. So anyway, you guys have a good weekend. If I've thoroughly confused me, let me know. Or confused you, let me know so that I can help you. All right, you guys have a good day.